Interviewing, still on menstruation. Inquiry into the menstrual cycle can be difficult. Some women are very precise and know the regularity of the bleeding, the quality and the quantity of the blood, and so on. Other women take little interest in their cycle and sometimes even assume that you, as a therapist, know where she is in her cycle better than she does. The length of the menstrual cycle is affected by many different imbalances. Spleen Qi deficiency, kidney Qi deficiency, and heat can make the cycle shorter. Heat will agitate blood, so the walls of the vessels rupture, whilst spleen Qi deficiency will not hold blood inside the vessels. The kidney Qi deficiency can result in the kidney failing to hold the uterus closed, so the bleeding comes earlier. If there is too little blood to create a menstrual bleeding, or if anything blocks blood, such as cold, blood stagnation, or Qi stagnation, the menstrual bleeding will be delayed. Liver Qi stagnation can cause the length of the cycle to be irregular. A woman should menstruate approximately 45 ml of blood during the menstrual bleeding. Many women have difficulty judging whether they have normal bleeding, as they only have experience of their own bleeding, and using tampon makes it difficult to gauge the amount of blood discharged. Asking about how often they have to change their tampon or pad and which type of pad or tampon they use can give an indication of the heaviness of the bleeding. Many women also have a reasonably good idea of the amount of blood there is, especially if they have heavy or scanty bleeding. Heavy menstrual bleeding can be seen when there is either heat or spleen Qi deficiency due to the mechanisms explained above. Blood stagnation can block the vessels in the uterus, causing them to rupture. This too results in heavy bleeding. Scanty bleeding is due to blood deficiency, cold, or blood stagnation blocking the flow of blood. Menstrual bleeding lasts longer than 5 days. Spotting before the menstrual bleeding and bleeding in the middle of the cycle are all signs of spleen Qi deficiency, resulting in blood not being held in the vessels. They can also be signs that heat is agitating the blood and rupturing the vessels, or that there is blood stagnation, creating a buildup of pressure so that the walls of the vessels burst. Inquiring about the quality of the menstrual blood is crucial. Again, some women can have difficulty answering this question, having seen only their menstrual blood. Describing the differences between the various colors and qualities can be useful. Pale, watery, or thin blood can be seen when there is blood deficiency and Qi deficiency. Very dark clotted blood is seen when there is blood stagnation. Qi stagnation will manifest with smaller clots, whilst cold stagnation can result in very small grainy clots that resemble coffee grounds. If there is a kidney deficiency condition, the blood may contain thin threads, and if there is damp phlegm, the blood will contain mucus. Bright red colored blood is seen when there is heat. Heat can also result in the menstrual blood being sticky. Brown colored blood can be seen when there are blood deficient conditions. Blood stagnation causes the blood to be very dark in color. If there is a lot of blood stagnation, the blood will also be almost black. The presence of menstrual pain is quality, and when it occurs, are important differential factors when determining which patterns of imbalance are present. Pain that starts prior to the menstrual bleeding is seen when there is liver Qi stagnation. Liver Qi stagnation pain is generally characterized by coming in waves and varying in its intensity. The word many women use for this is cramping. The pain can be located in front and on both sides of the lower abdomen. It can also cause soreness or pain in the lower back and may radiate down the inside of the thigh. This is because liver Qi stagnation will stagnate Qi and blood in Chong Mai. Thank you for your attention.